Hello, welcome to a day in the life of an African American man's journey through prostatectomy. I've got to learn to pronounce that word right. I've been saying prostatectomy and I've learned and since been told that I've been mispronouncing it. We are now 7 days past surgery. Some things, before I do that, I do want to talk about why I named the title the way I did. Is not to be divisive, not to be separate, but it's the demographic of African Americans who suffer the most from prostate cancer and prostate cancer deaths. You know, whereas 1 in 8 in everyone else in African Americans is 1 in 6, and we die twice the rate as everybody else when it comes to prostate cancer. So that's why I named the journey the way I did. Some of the things I've dealt with since surgery have gotten a little better, even though on, I guess it would be day 3 and day 4, the bladder spasms became just a tad bit more intense. And it was almost as if it was food related. I noticed some of the things I ate caused more agitation with my bladder, and it caused me, let's put it this way, they downright hurt. I'm not going to use a sugarcoat word. I'm not going to say they were uncomfortable. I'm going to tell you they were pretty intense. I noticed that carbonated drinks, spicy foods, gassy foods tend to cause more of an agitation to my bladder. Now, that's not to say that that's going to react that way for everyone, but that's just how I reacted, for me. I have noticed that, pain in my sides have changed a little bit as well. In certain spots they've gotten better, and in certain spots they've gotten a little bit worse, but I've been able to do just a little bit more each day. I get up in the morning probably about 4. Yes, I'm still waking up early. Get up around 4 and take my little dog for a walk. I move around the house pretty good, so things seem to be going in the right direction. I did get a phone call from my doctor, Dr. Michael Knox, who performed the prostatectomy. He informed me today that he believes that my Gleason score of 3+4, which is, I guess, 7, he believed everything was removed and it was all contained in the prostate, according to the other samples that were taken during the surgery. So, in 6 weeks, when the test comes back, everything is all negative, I will be in the all clear. Now, am I still facing some challenges? Yes, it is still weird to go to the restroom, to sit on the toilet with a catheter. The pain in that has become a little bit more intense because I guess when I'm going to the restroom, the bladder spasms will kick in, and and I'm going to try to say this as clean as possible, but that's when you begin to have a little bit of urine that comes out around of the catheter. That has the sensation in that, the burning sensation has picked up a little bit, but thankfully I can say yes, everything is now working. I have started to slowly but surely add things back to my diet. I've been able to take showers, although be it I can only wash in certain areas because I do have, I think I counted 5 areas where at some point in time I'll show you those scars. 5 scars plus the area where my J-pack drainage tube was. Just waiting to get back to, I can't say complete normal because things will have changed by then. But 7 days out, I feel like I'm doing very well. And, I've had a lot of questions come my way from a lot of people, a lot of questions from, I'm saying people, that's the wrong way, a lot of men who I know are wanting to know, did I have some type of, were there things going on that alerted me there was something wrong with my prostate? Well, growing up as a young man, I heard most men talk about having to go to the restroom more frequently. So even though that's not necessarily a determining symptom, in my mind, because that's what I heard, I just thought that was normal. As you get older, you go to the restroom a lot. But then I have since realized mine was a little more frequent than most. And I was having a little bit of pain in my urination, which probably was a symptom. But in which I started to just, like most men, we don't want to go to the doctor. We don't want to do anything. So when the doctor says, hey, is there anything different? We say, oh, no, it's just normal. Well, no, that's not normal. When you are going, I think I was probably on a school day as a teacher. We have 8 hours a day, and I would probably go every hour on the hour. In the sense of, if I didn't hurry up and get to the restroom, then I could have an accident almost every time. So yes, there were probably some symptoms. As far as any other than that, no, I didn't have any other symptoms. But the only thing I can say that with definitively, which will keep you alert to any symptoms, is going to the doctor, getting your blood work checked, and knowing what your PSA numbers were. Now, I should know this by now, but I don't medically. What numbers that they get worried about, I just noticed that my numbers had got higher and that my prostate was bigger than usual. As a matter of fact, I know it was bigger because Dr. Knox told me it was a rather large prostate and it was hard to get through, I guess, the pelvic area. So it took a little bit longer, whereas this surgery normally takes 2.5, 3 hours. This one took 4. So for now, 7 days out, that's where I'm at. And hopefully the next video, I'll be maybe doing jumping jacks, sit-ups. I mean, I don't know. Yes, here's a couple more things. Mentally, it gets tough to just kind of sit and recover, especially if you're somebody who is used to doing a whole lot of moving, used to roaming around when you want to roam around. I cannot drive as long as I have my friend. I've been meaning to make a name for my friend, but I have not yet. As long as I have my friend as a connection, I cannot drive. I will lose my friend on Friday. When I say my friend, that's my catheter bag. So yes, that is something that will be with me until then. So I ain't gonna say stuck, because I can leave the house whenever I want to. I just can't get in the car and drive and go wherever I want to go, which is unusually difficult for me. It's almost like when you tell somebody, don't look up, you're at a baseball or softball game, the first thing you do is look up. So when somebody tells me I can't, my body wants to go, but unfortunately I can't go where I want to go. But you know what? Being cancer-free, I can accept that for now. And again, thank you for watching. Thank you for tuning in. And again, if you have any questions, just hit me up in the comments and I'll be glad to get in contact with you and answer whatever I can answer. Now, I am not a medical person, so if you're looking for some medical terminology, I'm not going to have that for you. If you want to know about the catheter bag, if you want to know about bladder spasms, if you want to know about all those type of things, I can talk to you about that. It just won't be in medical terminology. It's going to be in Isaiah's terminology. Again, thank you for joining me. Have a blessed and wonderful evening. Goodbye.